Ang sinumang lingkod bayan ay may tungkulin na pinanumpaan. Nanumpa na maglilingkod ng buong puso batay sa tanggapan na kanyang pamumunuan. Bago ang lahat, mamamayan muna. Ito ang palatuntunang maglalahat ng mga tuwirang impormasyon upang magsilbing gabay ng ating mga nanunungkulan saan mang tanggapan ng pamahalaan para sa kapakanan ng mamamayan. Bago ang lahat, mamamayan muna. Maglalatag ng mga naangkop na payo para sa lahat ng mamamayan na umaasam ng tunay na pagbabago at kaginhawahan sa buhay. Bago ang lahat, mamamayan muna. At ngayon, narito ang inyong lingkod, Cora Alma de Leon.
Magandang hapon sa inyong lahat. Nag-beg off si Sonia Rocco. Nag-a-attend siya ng isang event, United Nations Association of the Philippines. And of course, si Lucy Lasso malilate. She's, I think, on the road. Pero I'm so happy that our guest is someone special na talagang mag-enjoy tayo sa interview sa kanya. Well, please like and share our live video in our FB page, Broad Streamcast Communicators. Follow me on Facebook at Corazon Alma de Leon, or you may contact me sa as indicated 0918-912-3546. Sinisimulan ko ang programang ito sa pagitan ng isang sinulat ko, Nasaan ang Araw. Matagal ko nang inasahan ang pagsikat ng araw. Matagal ko nang inasam-asam ang paglaho ng dilim. Ngunit bakit ganito ang buhay? Bakit ganito ang damdamin? Ang puso ay nagtatanong, ang diwa ay nagtataka, nasaan ang araw? Ang araw pala ay nasa puso, ang araw pala ay nasa kaluluwa. Nambala na, kung ang puso ay puno ng pagmamahal, hindi na kailangang itanong, nasaan ang araw? Kung ang kaluluwa ay puno ng katotohanan, hindi na kailangang itanong pa, nasaan ang araw? Sa isip, sa salita at sa gawa, nakapaloob ang araw, kailanman ay walang kadiliman, sa tuwa, katotohanan at pagmamahalan. Salamat sa pong may kapal, may kasagutan ng tanong kong nasaan ang araw. At kalakip nito sa ating programa ay binabasa ko yung isang sinulat ni Rabindranath Tagore. Sabi niya, where mind is without fear and head held high, where the world has not been broken to fragments by narrow domestic walls, where tireless strivings stretch their arms toward perfection, where the mind is led forward to thee into ever-widening thought and action, into that heaven of freedom, my Father, let my country awake. Totoo magigising tayo ng bayan at tamang-tama ang panauhin natin ay si Vena Pearl Bongolan. Babasahin ko ang spiel tungkol sa kanya, if you don't mind. Pearl is an applied mathematician at the Department of Computer Science of the University of the Philippines. With their MS and undergrad thesis students at the System Modeling and Simulation Laboratory, she currently studies predictive modeling of infectious diseases informed by telehealth and the cascade of disasters and their optimal mitigation. Her current project is A14 PEP, a beautiful segue to the COVID-19 modeling her lab has done since 2020, which put forward the theory of age stratification to account for COVID-19's bias against the elderly with comorbidities and use nonlinear incidence rates to account for human behavior and disease resistance factors. This will now be used to prepare the emergency response in case of disease outbreaks in Ati communities in Panay and Guimaras. The cascade of disasters, which uses concepts from network theory, dynamically systems, and optimization, will come up with planning tool for simulating cascade of disasters when planning an optimal mitigation response. This will then be used to plan for the mental health epidemic, which is posted to follow pandemics like COVID-19. Alam mo, this is close to my heart dahil na-COVID ako at talagang at talagang ang field na nakita ko na very important, lalo na because of the COVID, mental health. Ngayon, dahil ang team natin program is mental health, ang discussion is, ang unang pinatanong sa akin ni Lucy, how related is your work as an applied mathematician? Si Lucy ang mga nagtanong dito pero wala pa siya si Lucy. Go ahead, Vina. Dr.
Thank you for the
Vina pala.
Vena po. Yeah. I was
Vena,
named
yeah.
after my father, Benjamin. My late father was
Yeah.
Benjamin. So I'm Vena.
Vena, yes.
Yeah, Benjamin, Benjamina.
Good to
Well,
know.
yeah, good question. Actually, I got into epidemic modeling. Mathematically, it's very simple. We only use ordinary differential equations, which is
Mm.
not difficult to solve if you're a math major.
Yeah.
Hindi mahirap. And lucky for me, the group of Dr. Romulo de Castro, Jong, was looking for a mathematician. So we were all locked down, March 2020. We were locked down. I was locked down at home. I did not know what to do. And then my chair, my chair said, may grupo, naghahanap ng mathematician. Gusto daw nilang i-model ng COVID. I said, present, put me in. Put me in. So these
Galing.
people, I appreciate that Dr. De Castro knew that he needed a mathematician on his team and
Great.
to model his team. And that's me. I'm a modeler. So I was very happy and very lucky to have met Dr. De Castro and his team. Coincidentally, uh, many of us are from Philippine science actually, and I guess that's why they
Yes.
hanap tayo ng mathematician. They're in the life sciences. Dr. De Castro is a medical bioinformatician, but he knew he needed a mathematician. So I said, put me in touch with these people. They know what they're looking for. You need a mathematician to do this.
Galing. Anyway, ang gustong ni Lucy, remember, I'm speaking for Lucy dahil siya ang head nitong program na to.
Yes,
Sabi
ma'am.
niya, to ask you to talk about the Artificial Intelligence Project. A, A-4 ba to? O A14 PEP?
AI.
CAP.
AI. Yes, ma'am.
AI for
Yes,
PEP. Is
for
that
PEP.
correct?
Yeah.
For
The
PEP. Yes. Ayan na
acronym,
si
this,
Lucy. Wait,
yeah.
papag-greet ko lang si Lucy, but she's obviously on the road. Go ahead, Lucy. Hati
Hi,
ka
good
muna.
afternoon, everybody. I'm caught and trapped in the traffic, but
So,
anyway,
what's new, Joe?
that's a standard reason. So, I mean, I'm very glad to see Vina able to join us this afternoon. Alam ko may klase pa yan after the session
Yeah,
eh.
yeah.
But I said it's a very important segment that she's actually bringing into our show, no? So, good afternoon, everybody, sa lahat ng ating mga tagapanood. And maganda yung usapan. Tingnan natin, meron bang kinalaman ng mathematics sa mental health, no? Nakakaintriga, hindi ba? So I think Vina will share with us and tell us how all of this come together. And we
Mm,
are together in one project called Artificial Intelligence for Pandemic and epidemic preparedness, no?
galing.
So, oo. So yan. Merong basihan si Vina ng kanyang karanasan, no? Sige. Ah,
Galing. Actually,
yeah.
nakaka-impress nga at in sa akin na walang very little na kaalaman tungkol sa AI for PEP.
Mm-mm.
Sesegue tayo sa digital mental health, no?
Yes.
Ah, hindi muna tayo mag-uusap tungkol sa role, pero alamin muna natin sa kay Dr. Vena, ano talaga yung artificial intelligence project na siya ay involved. Yun muna, kumbaga
Yeah.
unti-unti nating aalamin, hindi natin bibiglain. Go
Yeah.
ahead, Dr. Ravena.
Yeah. Thank you. Thank you, ma'am. Uh, yeah, artificial intelligence is, well, one tool, a newer tool maybe.
Yeah.
Uh, and it's a Canadian project. Ano, malaki siya. There are 16 countries involved around the world. The
Mm.
theme is using artificial intelligence for pandemic and epidemic preparedness. That's the theme. Now, in the Philippine project na kasama si Ma'am Lucy Don, ang role lang naman ng AI is in predicting if there will
Mm.
be an infectious disease breakout. That's it. Yun lang naman ang role niya, no? My own role really is the modeling, predicting how many will get sick
Yeah.
based on my equations, no? So,
Mm.
isang component, I mean, at least in the Philippine project, artificial intelligence is just one component, and
Mm.
it will try to predict epidemic outbreaks by observing what's going on in the ate communities. No? Kasi there is already an existing telehealth program servicing 10 ate communities in Panay and Guimaras. Meron na doon. And now we will be monitoring that
Mm.
data to see na, okay, what's going on? Is there an outbreak or just isolated cases? No? So, and in fact, my teams, because even the newer technologies guy like AI and machine learning are actually my former students. We're in a race. Can your AI do better than my modeling to answer this question? Yeah, we're in a friendly race actually, a friendly competition. Let's see what you'll come up with, and I'll see what I come up with basically. Pero yun lang ang current na use ng AI, no, for the Philippine project. And
Mm.
so it's riding on an existing telehealth backbone. Nandun na deployed na yung mga tablets like that, no? The doctors
Mm.
talk to their patients on tablets.
Yeah.
In the ATI communities, kasi they're not very accessible po. The communities are isolated. They might be in the forest. So, andun na yun, no? That's set up. So, based on what's going on with the data in the tablets, we will just try to see if things are all right or if there's an infectious disease outbreak coming out.
Dagdagan ko lang,
Lucy,
Gina.
oo, ito
Oo.
ang tanong mo, 'di ba? What is
Oo.
digital mental health?
Oo.
Nire-repeat ko lang.
Oo. Idadagdag ko lang yung sa kwento
Yeah.
ni Vina, no? Ah, yung proyektong binabanggit niya, prior to that, meron ng ADB funded project na
Mm.
in-scale up, pinalaki. At ang talagang tinutumbok niyan, yung mga nasa remote villages. Ang karaniwan yan, sa Panay Island, yung mga ethnic groups na ang tawag sa
Yes.
kanila ati, no? So, ito ngayon, dahil maganda yung naging resulta nung unang proyekto, parang nakikita na pwedeng makagawa ng isang tool na makakapagsabi kung meron bang outbreak, magkakaroon ba ng outbreak, magkakaroon ba ng pandemya, magkakaroon ba ng epidemya. And that's where the mathematical part of it comes in. Si Lavina are observing the actual data that are received from the doctors, no? Pagka kinagkonsulta yung mga ati, mare-record, ano ba, meron bang sakit ito? Meron bang COVID-related ito? So, in other words, yung mga actual incident, nakaka-record, nare-record. And yun nagagamit yung, yung mga ginagamit
Info.
ngayon yung mga tablets. So, ngayon, yung
Mm.
mga datos na yun naman ang pag-aaralan ng mga experts katulad ni Dr. Vina na tinitingnan nila, meron bang link, meron bang kaugnayan yung mga nire-report na incident ng mga ng mga doktor at meron bang pattern, meron bang trend. So base doon,
Mm.
magkakaroon tayo ng isang tool para masabi na natin kung magkaka-outbreak ba o wala, no? So yun, I think that's a very important thing because kung maunahan natin at ma-predict natin, di makakakilos ka agad, makakapagplano ka agad. So, pag sinabing artificial intelligence, it's the intelligence, and this is now my interpretation, it's the intelligence that you derive from the actual happening, from the actual events, no? But you try to discern if there is a real significant pattern coming out of it. And mahalaga yon as a preliminary step para mga public health practitioners natin, kumbaga, maalertuhan na sila, masasabihan na sila na, oh, meron kaming trend na nakikita. Yun ang yun ang papel nila, no? Ngayon pag sinabi mong digital mental health, pagkakaugnay na lahat 'yan. Bago ka makarating dun sa pagseserbisyo ng mga ng mga
May
atis, for
sakit.
example, o
Mm.
ng mga may sakit, eh kailangan may basihan ka rin na, oh, dito sa lugar na to, sa barangay na to, mukhang pumuputok itong problema. And that's where the tool and the social service delivery or the health service delivery are very much related, no? So
Mm.
actually, Nina, you might want to to tell them yung ginagawa ng mga colleagues mo tsaka mga estudyante mo rin na yung depression, for example, na napapag-aralan na maaring malaman mo yan based on the speech patterns. Diba, Bina? Meron kang lecture na may kinalaman dyan? Meron kayong
Yes, ma'am.
pag-aaral?
Actually, that's the study of Dr. Strulia in Alberta, no?
Oo.
Kasi,
Mm.
because I am not the AI
Person.
Expert. Mm.
expert. That's actually
Ah.
the AI is actually being built or was supposed to be built in Alberta, the University
Oo.
Canada.
in
Oo,
Canada.
Canada. Yun ang
Yeah.
mga
in
partners
Canada.
namin sa
Yeah.
project eh. Oo.
Pero yun nga, baka po mag-change ang plans eh. Baka mag-change ang plans, no? So, what might happen is that the machine learning will be done here in the Philippines. And
Mhm.
what they will do in Canada, yun na nga, yung project ni Dr. Strulia, no, na it
Mhm.
relates to digital mental health. Sa ngayon,
Mhm.
deployed na. There's
Mhm.
an app in the phone
Mm.
that
Mhm.
will try to monitor the students. Right now, walang diagnosis. They're just student volunteers at the
Yeah.
University of Alberta and a university in in Spain or South America.
Yes.
Kayang
Yes.
magkastila ng app, no? Kayang
Ah.
magkastila.
Yeah.
And basically, parang minomonitor lang sila
Ulang.
how you feel this day, what were your activities this week, parang ganon, no? No one is diagnosed with anything, they are not patients, but they are student volunteers. Pero yon, the app is trying to detect based on how they sound,
Mm.
how they
Mm.
are actually feeling. If they might be
Mm.
depressed, if they might be stressed,
Mm.
yun,
Yes.
parang dinedetect nung app from the speech patterns, no? And
Mm-mm.
that is being done at the University of Alberta. And sabi ko, oh, baka makatulong to sa mga doktor natin, ano, na,
Mm.
kasi the doctor, of course, is concentrating on talking to the patient on the phone, kung may
Yeah.
Mm.
physical symptoms ba siya, kung ano, and
Mm.
you know, and might be might not pick up
Mm.
the other signs which are hard to
Yes.
Mm.
pick up talking to someone on the phone. But
Mm.
so it might be an added tool, no? Pero I think it's for further study kasi yun nga, sa ngayon, it is deployed among non-patients. They're just volunteers. So
Mm.
people
Mm.
who are not diagnosed with any condition, just talking about their day. Ngayon, sa
Mm.
ngayon, ano, that's the state of the experiment. But yeah, we might in the future use it for as part of the telehealth program. That's one possibility na nakikita ko, no? And that is
Mm.
being done in Alberta.
Lucy, isi-share
Ah.
ko na sa grupo natin, ako lang na COVID, no?
Oo.
Ang
Na-COVID na rin
COVID,
ako, ma'am. Na-COVID na rin ako.
talaga,
Yeah, I think
welcome to the club, no?
I strongly
Pero
suspect. I strongly suspect.
understandable na COVID ako because at that time, ang pagradyo ko, nagpupunta ako sa station, lumalabas ako. Pero ang
Yeah.
warning nun ay sa mga seniors, no? Kasi senior na ako, ay stay at home. Pero ang
Yes.
feeling ko, paano ka naman makakaradyo na nandun ka lang sa bahay? Because I didn't feel I know the technology. Pero it already happened. Pero at that time, walang gamot. Hindi mo alam kung anong, later na
Yes.
lang kami ng gamot. Nung when I was already with the Red Cross, binigyan kami ng gamot. And ang feeling ko, ay survive. Kaya ang tawag ko sarili ko, survivor. Parang katulad mo din, ano? Kasi nabuhay tayo. Hindi namatay. And yet, alam natin, libo-libo ang namatay. At the time from 2020 to 2022, yun ang period. Nagsimula na ng 2019, pero yung mga tinamaan ng 2021, may mga nauna ng mga namatay. Kaya sa akin, pagtingin ko ngayon dito, ang tanong talaga ay how can scientists like you could be harnessed effectively in the mental health program? Ang nakikita ko dito ay pag-aaral na gagawin ng mga siyentipiko na katulad mo, bakit unang-una, bakit nagkaroon ng sakit yung mga tao, anong hinarap nila? Because yung mga ati, ewan ko kung ang magiging isolation naman talaga ang nangyayari sa mga ati at saka yung mga cultural communities, no? Kaya sabi ko, ano kaya magiging sakit nila ng mental health? Wala silang pressures na katulad nasa city, nasa
Ah,
siyudad. Ewan ko. Ikaw, Lucy, siguro ang makaka-comment mo na dyan.
no, in fact, maganda yung tanong mo. Ano pa bang magiging sakit ng mga ati walang pressure sa buhay? But kinukwento sa amin ni Dr. Jong at saka ni sila Dazzle. No, next week, we will have her as a guest. But nung nag-workshop sila, alam mo, unsolicited, lumitaw ang mga issues, mental health issues ng mga ati. They volunteered how they were feeling, and most of them were suffering from anxiety and depression. Uh, Siyempre sa pananaw natin, wala silang stress. Hindi siguro pareho ng stress na nararanasan natin. Pero
Sa
iba
siyudad,
ang
oo.
stress. Oo, na nararanasan nila. So those are things that can be articulated at some point in time, and then maaring maging basihan, maging datos para sa pag-aaral na katulad ng ginagawa nila Dr. Vina, no?
Ganyan.
That's why I think yung issue mo na sinabi mo na paano ba natin for lack of a better term, magagamit ng husto ang mga scientist na katulad
Kalma.
ni Dr. Mina. Oo, sa mga ganitong social problems. Kasi kung titingnan mo siya, applied mathematician, nagtuturo sa College of Engineering, makinalaman yan sa sa sakit, sa COVID, sa pandemic, sa epidemic. Parang pagtitingnan mo, wala. Pero sa totoo lang, they are the ones
Malalim.
who Oo, they are the ones who are able to squeeze meaning out of the data trends that they get. Yung mga nai-report, yun ngayon ini-examine nila kung meron ba itong kawawaan, meron bang kahulugan ito. So that's the beginning of the process na tayo mga social scientists, hinihintay natin yan kasi sa totoo lang, pag sa diagnosis, hindi gano'n kadali ang mag-diagnose. In fact, I think the least developed part of medicine is the diagnostic part, no? Maski nga physical illnesses, iba-iba pa kumisan ng diagnosis. Eh. Kaya humihingi ka ng second opinion, third
Yeah.
opinion, etc. So, I think, in, di ba? In the case of mental health, ganun din yan. Meron ding issue ng, ano ba talaga sakit nito? Then that's where we need hard data para pagka nagsalita, nag-diagnose, tumbok ka agad. But that may take a long time, pero kailangan natin talagang pagtiyagaan. And we need
Mm.
a hard-nosed analysis and information na diyan tayo matutulungan nila Dr. Vina. They're good at that.
Mm. O sige, your turn, Dr. Vina. Kasi ang palangalan mo, Vena Pearl. O may pearl, ng mga
Yes,
perlas ang
yeah.
gusto namin marinig sa'yo. Ha? Sige,
And
go
yeah,
ahead.
Yeah, actually, my friends call me Pearl. My teachers call me Vena.
Oh.
Yes, actually, ma'am, yung mental health
Pero
is,
ang initial mo VP, kaya
yeah, yeah, I use
very
both.
ano.
I use both. Yeah. Actually, my other group is the Cascade of Disasters. I have
Mm,
an MS student working on that. He studies how things cascade, no? In this particular case, the cascade we're looking at is start with the COVID pandemic.
naman.
Anong mga nangyari? For the younger people, nagkaroon ng school closure.
Mm.
Yes,
Na-interrupt yung
they
education
dropped
nila.
out.
Stay at home
Correct.
and study. And anong stresses ang nangyari sa kanila doon? And they did suffer from stress. I noticed that from my students in 2020. Now, for the adults and people with families, anong nangyari? Nagka-COVID, nagka-business interruptions, some
Mm.
Yes,
business closed, in fact. Now, I,
yes.
I think that was a big, big stressor sa mga
Mm.
taong may pamilya, mga taong may pinapakain,
Mm,
pinapaaral. I think that was a big, big stressor. Tumaas ang
yeah.
crime noon, ma'am.
Yes.
Talagang naging desperado ang mga tao. Naging desperado sila. And then, I guess for other people naman, okay, nagka-COVID, nagsara yung mga recreation facilities.
Mm.
Ah,
Mm.
ako hindi makapag-swimming eh. Dahil naging parang notorious that
Delikado, yeah.
the dressing rooms and the changing rooms, the shower rooms, were COVID traps.
Mm.
Kaya
Mm.
nga, parang okay lang mag-exercise ka pero huwag kang mag-shower. Huwag kang mag-shower doon.
At
Mag-shower
saka
ka lang.
yung concept ng lockdown. Pag sinabing lockdown, saan ka? Bahay ka na lang. Sarado na yung
Yeah,
bahay
yeah.
mo.
And so,
Mm.
yun, we are looking at the cascade, mga nangyari, and those have probabilities. And now we're trying to see na nga how to prevent the mental health issues by
Effect.
studying the how the disasters cascaded, no?
Mm.
Kung paano nag-cascade yun. And that is how we plan to help the mental health issue, no? We can decide what can we do here. Can we help the businesses or help the recreation facilities, open schools somehow? Can we do that? You know, see where we can push.
Intervene. Mm.
Pero as a mathematician, nakita kong numbers. Numbers importante. Kasi
Yes,
ilan, you always check, ilan ba ang apektado? For instance, if we talk about disaster, nung ako'y Secretary of DSWD, tawag nila sa akin disaster queen. Kasi alam ko yung mga naapektuhan sa disaster. Parang binibilang. Eh, yung nasa Red Cross ako ngayon, as vice chair, ganun din. Binibilang din. Ilan ang nasaktan sa translasyon. Ibig sabihin, ilan ang na-damage. Kayo yung mathematics useful in any field. Ilan? Ilan ang talagang naapektuhan? Yun ang simple
yeah.
understanding ko. Magbibilang tayo, ilan ang naapektuhan at ilan ang hindi naapektuhan despite or in spite whatever event.
Yes, yes. Well, thank you. Thank you for mentioning that, ma'am. Kasi, yun nga, well, not only do we count how many were affected, we can project how many will be affected. Wala
Yes,
pang,
future.
yeah,
Oo.
yeah. So,
Predictability. Di ba ang
yes,
word nyo,
I think
predictability.
that is why John De Castro brought me into this project. It's actually for the predictions, no? Na
Mm.
if there's anything going on in the communities, we can anticipate how it will happen, no? Na parang we can well, I hope that we can anticipate the way it will unfold and prepare for it.
Mm.
Di
Tanong
ba?
ko,
Correct.
Rina,
Lucy, ikaw na.
oo, gusto ko lang tanungin kasi totoo na basically ang datos ninyo, mga numero, no? But how does it uh, aid in, the qualitative aspects of a phenomenon? Meron ba siyang maitutulong uh, in looking at the qualitative effects or impacts of, let's say, an epidemic or a pandemic? Meron bang ganon? Posible ba yon?
Well, we can include that. We can include that
As
Uh,
part of it.
in the nodes, no?
uh,
The qualitative impact, no? Kasi yun nga for in because the thesis being worked on is on natural disasters, no? What they want for AI for PEP, yun na nga, start from
uh,
COVID,
uh,
cascading into mental health. So it will be a different cascade. Pero yeah, we can add nodes
uh,
and the survey could ask questions on quality of life, I guess, and family relations, no?
okay.
And as we study it, ma'am,
Uh,
yun, my discussion with my students last week was, ma'am, I think we will, well, ako nag-suggest, no? Sabi ko, kasi sabi niya, ma'am, we need to ask questions about their family life. Sabi ko,
Yeah.
alam mo,
yeah,
palagay ko, kailangan natin ng social worker na. Kasi right now,
yeah.
ang kausap mo nga yung doktor. Sabi ko, this is not
Uh,
a new concept. In fact, in the States, if the hospitals admit a child or an elderly patient, they immediately call the social worker. Agad
Yeah.
yon, agad yon. The
yeah.
social worker is a government employee, is an independent professional who sort of oversees the entire process, no? Um, titignan niya yung process ng pag-take up, kung
Mhm.
anong tulong ang kailangan ng pamilya, sa bata o sa matanda.
Mm-mm.
And they're not really looking for abuse, although sometimes they see that, no?
Uh,
Kung
Yeah.
bakit daw hindi pinadoktor agad yung bata, bakit laging
Too late.
nasusugatan,
Oo.
may mga ganon, ano?
mm-mm.
That's the social worker's job, actually. Kasi nga, the doctor is busy with other things. Is busy trying to deal with the symptoms, no?
Uh,
At kailangan ng may ibang tao. So, that's the
yeah.
social worker. And so, yun ang discussion namin last week, no? Na my student said, Ma'am, these questions are not being asked
Uh,
currently.
Yeah.
Yun na nga, family relations,
yeah.
no?
Mm.
And
Uh,
also, finances, hindi tinatanong eh.
mm-mm.
Hindi
Mm.
naman kasi tatanungin ng doktor yun, ano? Parang,
Yeah.
Mm.
hindi kasi it's not part of the normal take-up procedure. And
Uh,
doctors are not used to asking that, no? And they might
Yeah.
not want to ask such questions. Kasi kung hindi naman normal sa protocol ng
uh,
tinatanong mo, you
that's
might
right.
get
That's
You
right.
will
hooked up.
never know. Oo.
And
Uh,
so I
In fact,
said,
nakita ko din yan, Lucy and Dr. Ravenna, yung mga nag-drop out during the pandemic, ayaw nang bumalik sa school dahil
uh,
na-traumatize or nakaproblema din ang pamilya. So,
uh,
importante ngayon, how do you motivate the students to come back to school para to finish what course they took? Or maybe change the course? Because napaka-importante na alamin ng mga nagaguro bakit hindi bumalik sa eskwela yung after the pandemic. Tapos na ang pandemic, hindi pa mabalik sa eskwela. Either wala palang trabaho ang mga magulang o kaya may mental health issue yung bata na
uh,
ayaw niyang makita na yung mga teacher na hindi nakita ng 2 years. I don't know. Sa akin lang, nakita ko may reason ang mga estudyanteng mag-drop out but we need to find out why.
mm-mm.
Di ba? O, ikaw
Well,
na,
gusto kong
Lucy, o
balikan
ano?
yung binanggit ni, no, Rina. Uh,
Di ba na?
yeah. Gusto ko lang balikan kasi maganda yung punto niya na um, kailangan yung interaction between the mathematicians, the scientists, and the social
And the social
workers, the
scientists,
social
yeah.
scientists. Oo.
Mm.
Kasi yung, for
Yes, yes.
example, ah madami diyan ang determinants ng mental health conditions or even for that matter physical health are social in nature. Isa na yung binanggit niya, family relations. But even simple demographics like male or female. Hindi ba, Vina, may mga findings na kung minsan mas mataas ang incidence ng mental health issues among the females than the males. In some cases, it's vice versa. Depende sa lugar.
Yeah.
So I think yun yung dynamics na uh, they are actually very qualitative in nature but can be analyzed using the tools of the mathematician, 'di ba? So yun yung
Statistical,
isang
Carol.
punto
Mm,
na oo,
yeah.
isang punto na I think
Yes, yes, we will,
magandang
well, we will need
sinabi
all
niya
those to
na
inform that, no? Kasi
oo.
we are looking at the literature. May nakita
Mm.
kaming parang eksaktong study, again, coincidentally from Canada, no? From
Yeah,
Ontario,
yeah.
Canada, on COVID to mental health. It's
Related.
a case study.
Yes.
And believe it
Yes.
or not, they have three, 300 question, 100
Dami.
item
As
Oo.
questionnaires. One
Oo,
for
oo.
adults, one for
Oo.
the youth, one for
Yes.
children. Sabi, kasi
Okay.
nga, ganun na, no? Kinakalkal na lahat. Yung mga
Yes,
hindi
yes.
makalkal ng doktor, na kailangan
Correct.
siguro kalkalin na ng social worker, kinalkal na lahat. Sabi ko,
yeah.
Correct.
alam mo, maski ethnicity, tinatanong, family relations, tinatanong. Sabi ko,
Yes, yes.
alam mo, well, maybe we do not need 100 questions. Maybe we know
Mm.
more about our clients. We know something about our clients. They're not totally unknown to us. Pero yun na nga,
Yes, yes.
I think we can simplify the questionnaires. Pero in the long term, I think that is the way we're going to go, man, Lucia, no? Na
Mm-mm.
we're going to, the,
Mm-mm. Mm-mm.
the network that we're coming up with the cascade, for the cascade of disasters will have to be informed by
Mm-mm.
questionnaires like that, no?
Yeah.
And
Mm.
yeah,
Yes,
kasama
yes.
naman kasi si Doc M sa Dr. Emmanuel Sevilleja. Jesus Emmanuel Sevilleja is from the National Center for Mental Health. Siya yung nagpapatakbo
He's a psychiatrist.
siya yung kausap namin for the Cascade of Disasters. Eh. He's the guy there,
Mm.
no, from the
Mm-mm.
National
Mm-mm.
Center for Mental Health. And he will
Mm-mm.
ultimately decide the questionnaires that will be deployed in order to
Mm-mm.
inform that network. No? Kasi
Yeah.
we cannot guess things for that network. Kasi yung nodes are
Mm-mm.
the disasters, the things that are happening. The edges are probability weighted. No? How did that
Mm-mm.
happen? And what's
Mm-mm.
the probability of that happening? Yun, doon
Mm-mm.
papasok yun eh. How those things interconnect. That will have to be
Mm.
informed by possible questionnaires, possible inputs from experts and the like.
Mm-mm.
Ito na
Mm-mm.
yung point.
Isa-share, oo.
Ito na yung point.
Isa-share ko din, Lucy at Dr. Avena, na nung
Mm-mm.
magka-disaster sa ano sa Taal volcano, no?
Yeah.
Yung affected areas dati iisipin kagad ng DSWD, ng mga communities na ilagay sila sa ano emergency centers, yung bang
Mm-mm.
parang ano
Evacuation
ilalagay sila doon.
centers.
Oo,
Mm-mm.
evacuation centers. Alam mo, yung nangyari doon, ang mga naapektuhan, tumira sa mga kamag-anak. In other
Mm.
words, naging phenomenon yon na hindi kinailangan maraming evacuation centers. Kasi maraming mga pamilya, kinuha nila yung mga naapektuhan at itinara sa kanilang bahay. Maganda din pag-aralan yon, ano? Yung pagbabago ng pananaw na
Nawala
hindi
si Cora.
kailangang, ha? Nawala
Nawala
ba
ka kanina.
ako?
Oo, oo.
Sorry,
Na,
sorry.
hindi, yeah,
Oh,
tama.
Now,
ngayon,
Hindi
okay.
maliwanag
kailangan,
na?
Now you're
Okay
back.
na?
Mm.
tama. No, I can
Okay
hear
na?
it. I heard everything, ma'am. I heard
Oo.
everything.
Okay.
Ngayon, ang nakita ko, kailangan din tingnan yung phenomenon na yon na hindi na mangangailangan ng assistance ng gobyerno, pero yung
Yeah.
pamilyang tinulungan or humingi ng tulong sa mga pamilya, yun ang kailangan tulungan. That's a new phenomenon na dati akong DSWD secretary, hindi ko nakita yun. Kasi at that time, ang tingin mo kagad, dalhin sila sa evacuation center. Diba?
Well,
Yes.
that is one thing that might be overlooked actually, that Filipinos have
Yes.
different support systems from foreigners.
Yes.
Sa US
Yeah.
siguro, o tama, evacuation center kasi magkakalayo yung mga kamag-anak or mga kamag-anak hindi naman ganun ka-close.
Yes. Samantalang sa family system natin,
Atin, I live where I live because my brother is 1.5 blocks away. Tuwan-tuwa yung mga kaibigan ko na nahanap ko tong where we are right now, where I'm not talking for you from. Okay ka na dyan, Pearl. Nandyan lang ang brother mo, hindi na kita problemahin. You know, I mean, because I'm living alone, syempre, my friends are concerned na paano ba tong, this absent-minded professor living alone, can she do it? Pero the fact that my brother, I have a brother,
lives
1.5
nearby.
away, sabi niya, ay, okay ka na dyan, Pearl, dyan ka na. Hindi na kita problemahin, no? So, iba yung support system natin, ano? Iba. From, and yeah, also, the guards in the building here, watch out for me. Tinuruan ko silang mag-take ng blood pressure ko. Alam na nila yung blood pressure ko, eh. Ganun, ano? So, we have a support system.
Nakakaiba.
Is not seen probably different from abroad, no?
Yes.
And that is why, like that Canadian model, sabi ko, just ko 100 questions. I don't think our psychologists and our psychiatrists will need 100 questions each for adults, the youth, and the children. I think if we talk to them, they might inform the network better than 100 questions asked of how many people.
Correct.
Kaya nga, yung feeling ko, yeah, that's a foreign study. I said, I don't think I need 100 questions. Maybe if I just ask Ma'am Lucy and Dr. Charibel, they might give me the answers I need. You know? Maybe some questions, but you know your clientele already. You know the ate. You know they're different from. They live differently. They're basically. Ang stress nun is food, ma'am. Kasi they're hunter-gatherers. They're not farmers.
Correct.
They're not farmers. Ngayon lang nga sila natuturuan na things like mango growing. Yung mga bata, may mga program to teach them raising mangoes, raising poultry. No, parang ngayon lang sila natuturuan. That is not part of their traditional livelihood.
Because at saka dati, Vina, mga itinerant yan dati eh. Di ba?
Yes. Hunter-gatherer society are really mobile. No, they're not settled. Nagsettle lang naman ng tao with agriculture. Kung saan ka nagtanim, disettled ka na. But hunter-gatherer societies, just like pastoral societies, really move, no? Yung mga nagpapastol, they really move around din naman, yeah.
But tsaka nawalan sila ng lupa sa ancestral domain. Isa pang factor yun, di ba?
Well, yun nga. Kasi you need several hectares of primary forest to sustain a hunter-gatherer society na nawawala na ngayon. We know that. No? Pawala na ngayon. The world has changed basically na wala naman tayong sisisihan. Pero yun yung reflections ko when I met the ate and I visited the communities. So nagkita kami ni Ma'am Lucy. Magkasama kami ni Ma'am Lucy sa Iloilo. But wala na kayo, ma'am, nung nagpunta tayo sa community, ano? I mean,
hindi na ako nakaalis
hindi
na
na kayo nasali doon. Pero sabi ko, alam mo, mahirap nang masustain ito eh. Kasi wala na yung primary forest din.
Correct.
Saan sila maghahan? Saan sila
Mm.
magga-gather? Kinausap ko si pastor, ma'am, yung
Yeah.
nagsalita sa ano, sabi niya, nung maliit ako, may nahahunting pa kaming bayawak, which is an
Mm.
Mm.
important food source for them back then.
Mm.
But
Mm.
now, with the
Wala nang bayawak.
wala ng bayawak, sabi niya, gusto ko
Mm.
nga sana mag-farm, mag-raise ng bayawak.
Mm.
Sabi ko, actually, ang bayawak is a delicacy among Ilocanos. Pero ngayon, wala
Oo.
na rin sigurong bayawak sa Ilocos eh.
Masarap. Masarap ang bayawak.
Yeah, kasi they
Hindi.
eat chicken.
Exotic
Parang
Ang
food.
chicken daw eh. Parang
yung
chicken.
uncle ko, meron siyang Philippine Reptile Products, gumagawa ng
Mm.
wallet, gumagawa ng belt
Yeah.
na siya ano, ng balat ng ahas, mga ganon.
Mm.
Bayawak, etc. Lahat ng klase. Kasi madami noon eh, at that time.
Yeah.
Anyway, meron pa tayong 5 minutes. I-summarize natin, Lucy, no? Kasi ang
Oo.
concern natin ngayon, way forward. Ano
Yes.
ngayon ang nakikita natin na pwedeng magawa? Definitely, yung digitalization ng mental health, nandiyan na tayo. Hindi na tayo
Mm.
kakawala diyan. Kailangan alam na natin yung facts and figures nangyayari. And then of
Mm.
course, yung association sa mental health, Lucy, talagang sa nangyayari ngayon, sabi nga apektado ang maraming tao. Kaya kailangan
Mm.
harapin natin yung katotohanan na yan. Sige,
Oo.
mag-ano na tayo, summing up na
Actually,
tayo.
oo. Siguro ang sasabihin ko lang yung mga kinuwento ni Vina has pointed out the kumbaga two sides of the equation, no? Isang punto is kailangan natin mas malalim na pag-aaral ano yung nagiging dahilan o ugat ng mga mental health conditions. So, we
Yes.
referred to them as the determinants and ang mga example na sinabi ni Vina ay yung family, I mentioned gender, marami pang iba, pati yung kanilang income source, yung kanilang primary occupation. No? So, I think there are a lot of things to explore there. And even, rather, we are seeing that the mathematicians like Vina, applied
Can help.
mathematicians, will be able to give us more precise understanding of how these things work, no? The other side of it naman na binanggit niya is yung tinatawag nilang cascade of events. Na pag may
Mm.
nangyaring nagkaroon ng trigger, nagkaroon ng stimulus, let's say a disaster or an
Disaster.
epidemic, oo. Ano yung nagiging resulta sa mga tao? So, there's a series of events that will happen and it may vary with the situation in life of a person. Now, in the case of the ati, nakikita natin yung pagiging ah, hunter-gatherer background nila, nakakadagdag sa stress nila, which stimulates and leads to mental health issues and conditions. So,
Yeah.
cascade of events, dinescribe kanina ni Vina na, alam mo, nagla-lockdown, hindi makapasok sa pag-aaral yung mga bata, sa eskwelahan mga bata, si tatay at si nanay walang pagkakakitaan. So, kikita mo yung chain of events na nangyayari as a result
Yeah.
of one particular
Event.
condition
Yeah.
like a pandemic, etc. No? So maganda yung kumbaga yung equation mo, both the determinants and the results or the outcomes, pwedeng ma-explore with the help of applied mathematics, no? And
Mm.
that's where kung mapag-aaralan yon, gagamitin naman nila yung mga techniques nila like machine learning, makakagawa ng prediction, may datos na pagbabasihan, at yung prediction naman na yon ang magiging basihan kung ng pagpaplano, ano ba yung public health or social intervention na kakailanganin. Ang malaking punto doon is yung you are able to look into the future, maybe not with certainty but with a certain degree of probability. Yun yung
Mm.
I think malaking naitutulong nila. Kasi kung
Mm.
malaman mo ng event more than 50% likely, aba kumilos-kilos ka na. No, I think
Mm.
that's the lesson we are learning from the mathematicians. And I think that's a good way of entering the arena, so to speak, and be engaged and be able
Yeah.
to craft tools to help our people such as the atis, no? So napakaganda Alam mo madami hindi nakakaintindi, nakakaunawa, or nakaka-appreciate ng anong magiging papel ng isang mathematician sa problemang mental health. Malaki po. Yan ang
Thank
natutunan
you.
ko rin na sa kanina,
Thank you
no?
po.
So para na akong
So,
final words from Dr. Avena.
yeah.
Well, marami
Go
pong
ahead.
salamat. Thank you for inviting me and giving a mathematician a chance to talk about the work we do, the work I do with my students. And I think, I think they're all waiting for our results, no? Na, okay, what should we do? What's the best way to go for mental health, no? And the same thing din naman dun sa modeling team ko na they're waiting for our results na, okay, if an outbreak will happen, what do we prepare? And
Yeah.
that's where what we are, no? Kasi we can
Yeah.
automate that, no? O sige, 50 galon ng tubig, 50 kumot, and so many medicines because we will try to anticipate the medicines that they
Yeah.
will need, no?
Yeah.
That is part of what my thesis students are doing. And I think everybody wants that too. So thank you po.
Yeah.
Thank you for
Thank you.
having me.
Ako
And
naman, in thanking you, I have this prayer for all of us, no? Prayer for the nation. Lord, let me be the change I want to see, to do with strength and wisdom all that needs to be done, and become the hope that I can be. Set me free from my fears and hesitations. Grant me the courage and humility. Fill me with spirit to face the challenge and start the change I long to see. Even if I'm not the light, I can be the spark. In faith, service, and communion, let us start the change we want to see, the change that begins in me. Actually, the change that begins in all of us and all the people who listen to this program, and looking forward to having you again in the future. Bahala si Lucy Lasso sa lahat ng
thank,
mga bisita dito sa mental health program natin. Thank you. Thank you very,
thank you
very
po.
much.
Thank you.
Thank you, Mina. Thank you all.
Inyong napakinggan at natunghayan ang Bago ang Lahat, Mamamayan Muna. Sa pamamagitan pa rin ng inyong tulay sa tunay na pagbabago, ang Broad Streamcast Communicators. Hanggang sa muli, maraming salamat po.